Tonight, we step quietly into a medieval town. The air is cold, the streets are narrow, and somewhere in the distance, a bell rings softly. Medicine exists here, but it does not always heal. In this world, doctors bleed their patients. Poison is prescribed as treatment, and survival often depends more on luck than skill. So dim the lights, get comfortable, and let us gently travel back to a time when cures could be more dangerous than the illness itself.
Close your eyes for a moment. It is the year 1348. You wake up feeling weak. Your throat is dry. Your skin feels hot. You don't know it yet, but your fate may already be sealed. Not because of the disease, but because of the cure. For centuries, medieval medicine rested on a theory that sounded elegant, logical, almost scientific. It came from the ancient Greek physician Hippocrates. Later, it was expanded and systematized by Galen. Together, their ideas formed the foundation of European medicine for over 1,000 years. The theory was simple. The human body was governed by 4 internal fluids, known as the 4 humors: blood, phlegm, yellow bile, black bile. Health meant balance. Illness meant imbalance. That was it. There were no microscopes, no bacteria, no viruses, just fluids and faith. The 4 humors. Each humor was linked to personality, season, temperature, and even emotion. Blood was warm and wet. It represented vitality and joy. Phlegm was cold and wet, linked to calmness and laziness. Yellow bile was hot and dry, associated with anger and aggression. Black bile was cold and dry, connected to sadness, melancholy. If you had a fever, too much blood. If you were depressed, too much black bile. If you were irritable, clearly yellow bile. This system was so convincing that doctors rarely questioned it. It explained everything, and when a theory explains everything, it becomes dangerous. Diagnosis without science. A medieval physician didn't check your heart rate. He examined your urine. Urine charts were widely used across Europe. Doctors would hold up a glass flask to the light, studying its color and sediment. Was it cloudy? Too much phlegm. Too dark? Black bile. They also examined your pulse, but not scientifically, more symbolically. Everything was interpreted through the humor system. The conclusion almost always led to one solution. You needed balance restored, and balance required removal. Bloodletting, the universal solution. Bloodletting was not rare. It was routine. It was performed in monasteries, villages, royal courts, everywhere. If you were wealthy, a trained physician might perform it. If you were poor, a barber would. Yes, the medieval barber was more than a hairstylist. He was a surgeon. The famous red and white barber pole still seen today traces back to this era, red symbolizing blood, white symbolizing bandages. A simple haircut could turn into a medical procedure. The process. There were 2 main methods: venesection, cutting directly into a vein. A physician would choose a specific vein depending on the illness. Headache? Arm vein. Liver issues? Different vein. Mental illness? Perhaps another location entirely. The cut was made with a sharp blade. Blood flowed into a bowl. Sometimes a measured amount was removed. Sometimes it wasn't measured at all. Patients often fainted. Weakness was considered proof the treatment was working. If you survived, the doctor claimed success. If you died, the disease was blamed. The treatment was rarely questioned. Leeches, nature's little surgeons. The second method involved leeches. Hundreds of thousands were imported across Europe. They were applied to the skin and allowed to feed. Leeches secrete an anticoagulant, which meant bleeding continued even after they detached. To medieval doctors, this was ideal. More blood leaving the body meant more imbalance corrected. In reality, patients risked severe blood loss, infection, shock. But remember, they did not understand germs. Infections were mysterious. Death was common, and medicine was guesswork wrapped in confidence. Seasonal bleeding. Bloodletting wasn't only done when someone was sick, it was preventative. Many people were bled according to the seasons. Spring was considered the ideal time, when blood was believed to be most active. Some calendars even marked the best days for bleeding based on astrology. Yes, your survival could depend on your zodiac sign. Royal patience. Centuries later, in 1799, George Washington was treated with aggressive bloodletting for a throat infection. Nearly 40% of his blood volume was removed in less than a day. He did not survive. Though this was technically after the medieval period, it shows how deeply rooted the practice remained. For over a millennium, Europe believed healing required subtraction, remove blood, remove imbalance, restore health. Except it rarely worked. Why no one stopped it? Here is the disturbing part. Many patients actually reported temporary relief. Why? Because losing blood can cause lightheadedness, even mild euphoria. It can reduce blood pressure. Some symptoms briefly improved. Doctors saw this as validation. Confirmation bias locked the theory in place, and without scientific experimentation, there was no system to prove them wrong. Medical knowledge was built on authority, not evidence, and questioning ancient scholars like Hippocrates or Galen was almost unthinkable.
The cure that was worse than the disease. Imagine this. You've survived bloodletting. You're weaker than before, but still alive. Unfortunately, your symptoms haven't gone away. Maybe it's a rash. Maybe it's joint pain. Maybe it's something far more feared in medieval Europe. Syphilis, a disease that spread rapidly in the late 15th century. Painful, disfiguring, mysterious. Doctors didn't understand bacteria. They didn't know about infection. But they did know one thing. This disease needed something powerful, something aggressive, something extreme. And so they turned to a metal, mercury, the shiny promise of poison. Mercury had fascinated humanity for centuries. Liquid at room temperature, shiny like silver, almost magical in appearance. Alchemists believed it had transformative properties. If it could transform metals, perhaps it could transform the body. Medieval physicians began prescribing mercury for skin diseases, parasites, and most notoriously, syphilis. The logic was simple. If the disease was aggressive, the cure had to be more aggressive. How it was used. Mercury wasn't given in small, careful doses. It was applied as ointments,
inhaled as vapor, injected into wounds, even ingested. One common treatment involved locking patients inside a heated box while mercury was vaporized beneath them. They would sit there, sweating, breathing toxic fumes. Doctors believed the sweating expelled toxins. Patients drooled uncontrollably, a symptom of mercury poisoning. To physicians, excessive salivation was a good sign. They even had a phrase: "A night in the arms of Venus leads to a lifetime on Mercury," meaning one mistake could lead to years of treatment, years of poisoning. What actually happened? Mercury is a neurotoxin. It attacks the brain, the kidneys, the nervous system. Symptoms of mercury poisoning include tremors, hallucinations, memory loss, mood swings, organ failure. Ironically, some of these symptoms looked similar to late-stage syphilis, so when patients worsened, doctors believed the disease was progressing, and they increased the dose. It became a vicious cycle. Poison causing symptoms, symptoms blamed on disease, more poison prescribed. Royal and elite patients. Mercury treatment wasn't limited to peasants. It reached royal courts. There are long-standing debates that Henry VIII may have undergone mercury treatments. While historians still debate whether he truly had syphilis, mercury was widely used during his time. The elite suffered the same fate as commoners. Status did not protect you from bad medicine. In fact, wealth often meant more aggressive treatment, more mercury, more bleeding, more experimentation. The psychological illusion of improvement. Here's something disturbing. In early stages of syphilis, symptoms can temporarily disappear on their own. So when patients took mercury and their rash faded, doctors claimed victory. They believed the poison had worked, but the disease wasn't gone. It was simply entering a latent phase. Years later, when neurological damage appeared, it was considered a new illness. The connection was rarely made. Medicine lacked long-term clinical studies. There were no double-blind trials, only observation and assumption. Beyond syphilis. Mercury wasn't just for one disease. It was used for skin infections, digestive problems, parasites, even mental illness. In some regions, mercury compounds were mixed with chalk and applied to children. Children. The idea that something so toxic could be medicine seems shocking today. But remember, in the medieval worldview, illness was imbalance or corruption. Mercury was harsh. It burned. It forced reactions. And anything that caused a reaction was believed to be powerful. Powerful meant effective. The cost of aggressive medicine. The Middle Ages were obsessed with forceful treatments. Bleed the body, burn the wound, poison the infection. Gentle medicine was seen as weak. If you didn't feel worse during treatment, it probably wasn't strong enough. This mindset cost countless lives. Not always immediately, sometimes slowly. Mercury poisoning can take months or years to fully destroy the body. By then, no one blamed the cure. The original disease carried the reputation. The treatment escaped judgment. A culture of authority. Why didn't anyone question it? Because medicine was built on tradition. Ancient texts were sacred.
challenging them was intellectual rebellion. Universities taught Galenic medicine as truth. Physicians were trained to trust old authorities more than new observations. If a patient deteriorated, the theory couldn't be wrong. The patient's body must have been too weak, or too sinful, or too corrupted. Blame was shifted away from the treatment. Always. The irony. In some rare cases, mercury may have slightly reduced bacterial activity, but the dosage required to be effective was dangerously close to lethal. The margin between treatment and poison was thin as razor. Most patients crossed it. Transition.
A hole in the head. Imagine suffering from constant headaches, blinding pressure behind your eyes, dizziness, confusion. In the modern world, you might take painkillers or get a brain scan. In the Middle Ages, your doctor might reach for a drill. Trepanation, also known as trephination, is one of the oldest surgical procedures in human history. Long before medieval Europe, ancient civilizations were already cutting holes into skulls. But during the Middle Ages, the practice continued, guided by a mix of classical theory, superstition, and desperation. The reasoning varied. Some believed illness was caused by trapped pressure inside the head. Others believed evil spirits entered the body through the skull. If something was inside, it had to come out. The influence of ancient authority. Like bloodletting, trepanation was supported by classical medical traditions linked to Hippocrates and later expanded through medieval interpretations of Galen. Head injuries from battle were common. If a skull was fractured, surgeons sometimes removed bone fragments to reduce pressure. In certain trauma cases, this could actually help, but the logic slowly expanded. A hole in the head. Imagine suffering from constant headaches, blinding pressure behind your eyes, dizziness, confusion. In the modern world, you might take painkillers or get a brain scan. In the Middle Ages, your doctor might reach for a drill. Trepanation, also known as trephination, is one of the oldest surgical procedures in human history. Long before medieval Europe, ancient civilizations were already cutting holes into skulls. But during the Middle Ages, the practice continued, guided by a mix of classical theory, superstition, and desperation. The reasoning varied. Some believed illness was caused by trapped pressure inside the head. Others believed evil spirits entered the body through the skull. If something was inside, it had to come out. The influence of ancient authority. Like bloodletting, trepanation was supported by classical medical traditions linked to Hippocrates and later expanded through medieval interpretations of Galen. Head injuries from battle were common. If a skull was fractured, surgeons sometimes removed bone fragments to reduce pressure. In certain trauma cases, this could actually help, but the logic slowly expanded. Headache, seizures, mental instability. Perhaps pressure was building inside the skull. Perhaps the humors were trapped. And so the procedure spread beyond battlefield necessity into general medicine. The procedure. There was no anesthesia, no sterile environment, no knowledge of bacteria. The patient was restrained. A circular incision was made in the scalp. Then, using a hand drill or scraping instrument, the surgeon slowly bored into the skull. Not all the way through at once, gradually, carefully, layer by layer. The goal was to remove a small circular piece of bone. Sometimes the dura mater, The protective membrane over the brain was left intact. Sometimes it wasn't. The operation could take hours. Pain was intense. Infection risk was enormous. And yet, archaeological evidence shows something surprising. Some patients survived. The evidence in bone. Skulls discovered across Europe show signs of healed trepanation. Bone growth around the edges suggests the patient lived months, sometimes years after the procedure. This is one reason the practice continued. Survival was proof. But survival does not equal success. We don't know how many died. We only find the skulls of those who lived long enough for healing to occur. The silent majority left no testimony. Trepanation for the mind. By the late medieval period, trepanation wasn't only for injury. It was sometimes used for what we would now call mental illness, severe depression, psychosis, uncontrollable behavior. In a world without psychology or neurology, abnormal behavior was terrifying. Some believed demons were responsible. Others believed corrupted humors had accumulated in the brain. If evil had entered, a hole could let it escape. It sounds primitive now, but within their worldview, it was logical. If something is trapped inside a closed container, you open the container. The skull was treated like a sealed vessel. Surgery without germ theory. The greatest invisible threat was infection. Medieval surgeons did not wash their hands with antiseptic. Tools were reused. Operating spaces were not sterile. After surgery, wounds were sometimes treated with herbal poultices or even animal-based mixtures. Many ingredients may have had mild antibacterial properties. Many did not. Post-operative infections were common. Swelling, fever, and delirium followed. Ironically, these symptoms were often interpreted as part of the original illness. The procedure itself was rarely blamed. The role of barber surgeons. Just like bloodletting, trepanation wasn't always performed by university-trained physicians. Barber surgeons handled many procedures. These were practical men, trained through apprenticeship rather than formal education. They amputated limbs, extracted teeth, and occasionally opened skulls. Surgery was considered lower status than academic medicine. Physicians diagnosed, surgeons cut, and patients endured. When it actually helped. Here's the complicated truth. In cases of skull fractures with internal bleeding, trepanation can relieve pressure. Even today, neurosurgeons sometimes remove part of the skull temporarily to reduce swelling. The difference? Modern medicine understands anatomy, sterilization, anesthesia, monitoring. Medieval surgeons sometimes stumbled into procedures that could work, but without understanding why. It was medicine by partial accident. When it succeeded, it reinforced the practice. When it failed, the patient was blamed. Fear of the head. The head has always been sacred, seat of the soul, home of thought. To cut into it was extreme, and yet desperation overrides fear. Chronic pain is persuasive. Seizures are terrifying. Violent mental episodes threaten communities. If drilling a hole offered even a chance of relief, families took it. Imagine the courage or despair required.